Okay, everyone. Good afternoon and welcome to the Consumers Health Forum Federal Budget webinar. My name is Elizabeth Deveny. I'm the CEO of Consumers Health Forum. I'd like to begin our webinar by welcoming you all. And as I do that also, I'd like to acknowledge the traditional owners of the lands on which we're meeting from all across Australia. For me, I'm in Ngunnawal and Ngambri country. I'd like to pay my respects to elders past and present, and also acknowledge the traditional owners wherever you are and any Aboriginal and Torres Strait Islander people who are on the webinar with us today. A special warm welcome to you all. Thanks, Jenna. So we can move along. Beautiful, thanks. So just a quick overview of what we're doing. I'll talk a little bit about the budget context, give a bit of an overview and a bit of discussion at the end, perhaps about what we'll do, which might be informed by the questions and answers. So a few things to think about. We've opened the chat and the Q&A. We really would encourage you to put any questions that you have in the chat early. We've got a team here. We'll be looking at those questions. We will try and answer as many as we can, but we also might be able to develop some themes during the session and then respond to half a dozen questions in the one go at the end. So encourage you to put into the chat now your name, where you're from, what country you're on. We always love to know where people are coming from. If you have questions, pop everything in now so that we can have a look at it. Depending on how many questions there are, we may not get through them all, but if we've got them, then we can use them to inform the conversations we have with the Department of Health and Ageing about what's important for health consumers out of this budget. After the webinar, we will, as we often do, post a link to the webinar. So if you have to leave during the webinar, or if you have a friend or colleague who can't be with us today, they can certainly join in by looking at it later on. And we'll also post the slide pack. There are quite a few slides and quite a lot of information. Some of them I'll go fairly quickly through because it's really just to provide you with an overview. But again, rest assured that you can look at those slides if they're helpful at your leisure. So encouraging you, thanks for those who have already put in the chat where they are. Keep that going and encourage you to start asking us questions. What do you want to know about the budget from the perspective of health consumers? So we surveyed consumers a few months back to ask them what they wanted. This is their top 10 list of things they want from the government. And this is our early assessment of how did the budget deliver on those things. So what you can see is the top 3 for consumers, that putting consumers at the centre, bulk billing and more holistic care. We think there's definite improvement here in the way that the budgets come out. In the other areas, more or less, sometimes as it is very early and not a lot of detail yet, it is hard to know exactly how this will pan out for each of us in our healthcare. And so where there's not been a lot of evidence, we've tended to be a little cautious in saying this is the budget's delivered at this point in time. Thanks, Jenna. So the budget context we're all well aware of. I think there were very high expectations of this current government to do a lot for a lot of people. And we can see that in the commentary more broadly post the budget. Some people feeling like they were heard, others who wished for a lot more from a government who they thought would leave no one behind. The government did indicate before the budget, certainly the health minister was on record as saying all of the things he'd like to do and all his things that the Albanese government would like to do could not possibly be addressed in one budget. These are the priorities that they've identified, and we've got what we've got, and we'll work with that over the next 12 months. Thanks, Jenna. So there's a lot about Medicare in this budget. And Medicare is a complex beast. As many of you know, there are 6,000 odd item numbers and all kinds of slow and mysterious ways in which it works. So there is a lot of detail yet for all of us, and particularly for everyday consumers, to understand what these changes mean to them and when these changes will apply. We've heard anecdotally from general practices, pharmacies and other places that already people are turning up and saying, when can I get my 2 months worth of medicine? When can I get bulk billed? Can I sign up for my Medicare? Is this new program available? So there's clearly a lot to do in educating all of us about what it is the budget means, and then in turn going out across Australia to 25 million people to help them understand how these new investments in health, primarily in primary healthcare, might help them stay well and stay out of hospital. There is a lot of emphasis on chronic disease when we look through a lot of the different funding measures. What is hard to see at the moment is how this will all join up, and I might talk about that a little more. So clearly a focus on chronic disease in what some of us would call the big four, things like heart disease and respiratory disease. Other chronic diseases like drug and alcohol, substance use disorders, some mental health issues, not perhaps receiving as much funding as those more traditional chronic diseases. Thanks, Jenna. We've been gathering the views of some key stakeholders. There are a few slides here. I'm not going to go through everyone. You'll be able to read those at your leisure. It's fair to say that it's a generally positive response to the budget. Most organisations welcoming things. Interestingly, or perhaps not surprisingly, those that support doctors coming out saying they're really happy with the changes. But there is a lot of detail, and a number of people in their releases comment this looks good, but they're waiting now to see what it means. The workforce measures across all the professions have been generally pretty well welcomed. I think the question for us and for health consumers will be, does this mean that I'll now have a local service that I can access, particularly for those living in rural and remote communities? So there is one thing in providing a workforce incentive, completely different. Question is, do people actually go to those communities? Do they undertake those new roles? Do those placements and do those incentives drive the redistribution of our health workforce in the way that many Australians would like it to? Thanks, Jenna. So let's look at strengthening Medicare. So there's a lot in here. The one that has received the most airtime in the traditional media is definitely the bulk billing incentive change. So this is a change where some people will be eligible to be bulk billed and the GP given a significantly higher incentive than they were in the past. Not everyone. The Minister said around 50% of Australians would be eligible to access this bulk billing incentive, or for their primary care clinician to access this bulk billing incentive on their behalf. So I suppose for us the question is, what about everyone else? My Medicare, I'll talk about in a little longer. There's a lot of discussion in the budget papers about the implementation of My Medicare, which in the past we've called voluntary patient enrolment or voluntary patient registration. The idea that you have a primary care home of some kind and you register there, and as a consequence of that, there are some services that you can get there that you can't get if you just walk into a practice. There has been a little bit of commentary that suggests that as we start to introduce things like a bulk billing incentive that differentiates between certain kinds of people being eligible and others not, My Medicare, which requires you to be in a certain place to get access to Medicare, is potentially the beginning of the end of universal healthcare as we might understand it. So rather than saying that every Australian can access everything Medicare has to offer, what we are seeing now in this is that not every Australian can actually access everything. And maybe that's a good thing. Maybe we're putting the money, the taxpayers' money that funds Medicare in the right place now, rather than having it available to all, or perhaps we're not. Would love your thoughts about that in the chat. Do you think this is a good thing, or perhaps not quite so good a thing? There's also a bit of funding for various kinds of after-hours services, the urgent care services, after-hour programs, after-hour call line. Again, our question's always about How is continuity of care put in place? How do consumers understand all these options and where to go to which one, what's available locally for them, and how do we ensure that as they move from service to service, that the quality and safety is great and there are no risks to their health as they move from one health professional caring for them to another. Next slide, thanks, Jenna. There's also, as I mentioned, some work in the spaces of suicide prevention and drug and alcohol. There is a big new piece around wound care and chronic disease. Those with chronic disease who have wounds that are very expensive to manage, we'll be delighted to see that additional funding provided in wound care, as well as some additional funding or continuing funding for the heart checks, which we know that our colleagues at the Heart Foundation worked very hard to encourage government to consider continuing that particular piece of work. These new longer Medicare rebates for consultations of 60 minutes or longer will be for some people really helpful where they have complex needs and need a long time to talk to their GP about those complex needs. There's also been commentary, I think Minister Kearney said often these more complex conversations are those that occur primarily for female GPs, and so for those in particular, this might be funding for the work they were already doing, which is terrific. Thanks, Jenna. Sorry, folks, wonders of modern technology there. Priority populations. So we see in a lot of the budget papers a conversation about trying to support those Australians that are doing it tough, and the government identifying some populations in particular that it wants to support. There is some funding here for some of these groups here. Again, when you look at the general commentary, there is some commentary around the tax cuts and the dissonance between providing tax cuts for those who are working and paying a lot of tax, and the funding that's going in to support groups that are really struggling to meet the costs of their healthcare needs and indeed the costs of a roof over their head and their food. So there are, it's good to see some work in this space, but I think there's a lot of questions about more broadly, has the government got the balance right? And I suppose that's a wait and see for all of us. Thanks, Jenna. Big funding for digital health, nearly $1 billion across a range of different elements. One of these, which is, as you can see down the bottom, I mentioned this My Medicare. So this is the portal that we use, the digital portal where you need to register your interest in being connected to a local general practice. When CHF have worked with consumers to ask them about this idea of being connected to a practice, I think the general view has been, yes, this could be a good thing for some people, but I'm not sure that it's going to be good for me. There are consumers who are concerned about things like, what if I'm not in my local area and I need care? What if I would prefer to have more than one person managing my healthcare? So I might see someone who's specialist in a chronic disease for some of my care and someone who's specialist in another aspect of my healthcare. How does that work if now I've got one practice to register with rather than two practices that I might register with, or three? What does that mean for me being able to choose the way that I access healthcare more broadly, and lots of other questions aside as well. So we look forward to seeing how that My Medicare program rolls out. Many Australians have joyfully embraced e-prescription, particularly during the pandemic, and good to see that that continues to be funded, as it's one of those things that consumers often talk about being one of the handiest things for digital health. Of course, when we talk about digital health, we often talk about digital inclusion. And so as the government funds digital services, whether they're mental health services, whether it's the My Medicare portal or telehealth appointments, the question is always, are these services equitably distributed? Can all Australians access them? And indeed, can those Australians most in need of healthcare access them? And what we'd hope to see is, as this digital work rolls out, that there is a strong component which is supports digital inclusion, that we're providing consumers with digital health literacy, and we're also ensuring that if people can't afford the costs of digital health, whether that's having a device, having Wi-Fi, whatever it might be, the digital health mechanisms are not accessible, that they are made accessible so that everybody gets access to these services. Thanks, Jenna. There's also funding for a lot of the activities of the Australian Digital Health Agency, and this is really to modernise and manage the My Health Record platform, as well as a range of other infrastructure functions that the Digital Health Agency manage. And there is funding for some compliance work that comes out of the independent review into Medicare integrity and compliance. Again, we'd love to see a consumer role here. So if you think that perhaps the wrong item number was used when you were accessing Medicare, how do you know as a consumer where to go to report this? How would you even know it was wrong? What are the things that consumers care about, and how can they quickly identify any issues that they might have in relation to how their Medicare card's been used? So it'd be great to see an opportunity for consumers to talk about what it is they want to see in terms of compliance for Medicare. Thanks, Jenna. Preventative health. Well, there's not a lot here in the preventative health space. There are a few key initiatives that have been funded. The National Lung Cancer Screening Program that the Minister announced during his press club speech recently. ACDC, or as we call it here, ACADACA, being funded for $90 million. Love to know in the chat what you think, which ACDC song should be used as their theme song. Here we're thinking it's either Back in Black, given they got 90 million to get it going, or potentially Highway to Hell, if indeed we do have another disease that requires a lot of work from ACADACA. So love to hear what you think its theme song should be. And we're still working on that, work in progress. Thanks, Jenna. Service linkage, there are actually quite a few, but here are a few of the programs which are looking to provide some kind of wraparound service for communities. So again, as a consumer, I'd say, all right, so I could potentially be enrolled in this first program, which is about helping people who regularly attend hospitals because of their complex and chronic health needs to manage their care more in community. There's also a piece for PHNs to commission allied health services for people with significant chronic disease. Then there's also the Medicare funding that can flow when you're registered for My Medicare, and there are a couple of more besides. So again, as a health consumer, I wonder which one of those is going to help me, and how do all of those different services come together? We want joined up initiatives and joined up care, rather than funding driving silos of service reform. So all of these initiatives on their own look terrific. The question is, how do they come together in a way that's meaningful for consumers? And at the risk of sounding like a broken record, how important is it that consumers are provided with information about these services so they understand how to access them, they understand which service might be best for their health needs, and they're able to easily, in a timely and affordable way, access these various mechanisms. Thanks, Jenna. There's another service here which is about a place-based approach to commissioning of, again, services, wraparound services. So, and workforce incentives for team-based care, and increase to the workforce incentive program. All of these pointing towards more wraparound care, particularly for those people with significant complex or chronic disease. There are so many of them that on one level you could be delighted to think there is a lot of work happening in this space, but there's always a risk that this work, because it will occur at pace, at the same time somehow provides us with 7 doors to walk into when we're looking for a wraparound service for chronic disease, and not as much funding for navigation and support of consumers to help them understand all these new options and what might be best for their health care. So we're really looking forward to working with all of you and with governments to make sure that this money is well spent, in that consumers understand what the services are that are available for them and they're able to access them. Next slide, thanks. Thanks, Jenna. So rural and regional, again, mixed reviews here from our rural and regional colleagues. Some thinking a lot of this will really make a difference for communities, others less sure. There's a big workforce investment in a lot of this. And I suppose the question is, if you build it, will they come? So providing workforce incentives, placements, and all kinds of other things for the bush, does that mean that these services will be provided in the bush, or will some of these funds remain unacquitted at the end of the financial year? Next slide, thanks, Jenna. There is some funding for First Nations people, a big piece around cancer outcomes for First Nations people, as well as some other pieces of work. Most of this funding, if not all, will go to the Aboriginal community controlled health sector, which is fantastic. They do amazing work on the ground. For us, it's always the question about, well, how do we make sure that if you're a First Nations person, wherever you choose to get your healthcare, you get not only a culturally appropriate response, but also access to all of the services you'd get from any one location. And building a bridge between mainstream and community controlled service models. Thanks, Jenna. Consumer engagement, CHS been provided with some funding to do some work in supporting the strengthening Medicare changes. So some of those conversations have been happening since the Medicare Task Force report, talking about, if we're going to reform the system, how do we make sure consumers not only have a say in how that happens, but also we make sure that consumers understand what these new processes mean. Throughout the papers, there are a number of comments that suggest co-design. There are a number of programs that clearly need additional health literacy put in place. So we look forward to working with all of you and, again, government, to make sure that that happens. Next slide. Thanks, Gemma. Pharmacy and prescriptions. This 2 months worth of PBS medicines was announced a little while ago. Some of you will be aware of that change already. There's been a strong response from pharmacy owners about the potential impact of this on the profitability of pharmacies, and of course the local pharmacy is very important for many Australians. We want to make sure that they're able to continue to provide the services that Australians depend on them for. We also hear, though, from consumers that many people simply can't afford their medicines. They're choosing not to take them. They're choosing to prioritise one medicine over another, and that of course can have dire consequences for their health. So somewhere we have to find a way forward which ensures that people can access their medicines, and also that we keep our pharmacies open and able to support everyone. Thanks, Jenna. A recent announcement many of you will have heard about as a change around vaping and smoking, also builds on the work, the additional funding for cancer screening for lung cancer. So there's a lot of work happening in the respiratory space here, and particularly for young people, supporting them to understand what these changes mean and what it might mean if they have to give up vaping, having only just taken it up, perhaps in a very short period of time, be really important to do. Thanks, Jenna. Young people more broadly, there is a little funding for some youth mental health services. Young people under 16 or those that are holding concession cards will be able to access some of the bulk billing incentive programs potentially, as well as, of course, register through My Medicare if they want to have a local practice that they use. There is some funding provided to support young people more broadly. I think, the commentary seems to be it's good that something was provided, but perhaps it's not enough. Potentially some of the workforce work, particularly scholarships and placements, might provide those young people who are seeking a career in health the opportunity to do that. Thanks, Jenna. We had a little bit of a look across the health professional disciplines, and this is a really quick reckoner of where the money has landed. So we've got about $4.2 billion if we add up these few key initiatives. There's a little more besides this going to the medical fraternity. There is much less funding going directly into nursing, though we note there's a lot of work happening in aged care. But here we're talking about particularly out of aged care, so primary care and care and community. Pharmacists, again, 2.7 billion in these announcements, so a lot of funding going through here to our local pharmacies. And in allied health, there are no specific measures. So there is talk about commissioning allied health. There's talk about general practices being able to commission allied health services or use the workforce incentive program. But I think for a consumer who actually relies heavily on people from allied health disciplines, be a speech pathologist, an occupational therapist, psychologist, whoever it happens to be, they often have to manage quite significant out-of-pocket costs. And while some of these programs look like they will provide a bulk billing or block funded mechanism, it's not clear on what the overall impact will be for people and whether people will really get an improvement in the overall costs or reduction, if you like, in the overall cost of their healthcare when they need to seek allied health support. The same is true for secondary care, with people saying it's great that I'm able to see my GP or get access to various new primary care services, but I rely heavily on secondary care, and that means that doesn't help me with the costs of that. Next one, thanks. There's a little movement on dental care. We would have liked to see more funding go into dental care and community. There isn't a plan to increase the funding for preventative health, which has been mooted to happen in the next few years. We don't really see the beginning of that in this budget. And the COVID measures are more about what we do now, not so much yet for things like long COVID and longer term prevention. Thanks, Jenna. I also note that wellbeing is a really important part of healthcare, and that the impact of climate change and things like climate anxiety can be intrinsically linked to our wellbeing. So there's not a lot of green stuff in this budget, and we think that many health consumers would like to see that, either because of the physical impacts of things like pollution, for example, on their respiratory conditions, through to the concerns and the impact on their mental health and their concerns for the planet and for each other, even the cost of their heating or their risk of being in a bushfire. So it'd be lovely to see that progress over time. Thanks, Jenna. Yes, all the slides are coming to you at the end. Someone just put that note in. I did say that at the beginning. Sorry if you missed it. There's a lot more information here. We've put some links here, and when you get the slides, you'll be able to click on those. And this is early days for us too. Like many of you, we're trying to work through all of these measures. There's a lot of reform in here, but what we want always is more information, more detail, to better understand the on the ground. So if I'm I don't know, I was a single mum with one child who had special needs. This is me, a few years past. What would this mean for me? Would it mean I'd now be able to afford things that I couldn't afford before? There were times when I couldn't afford 3 meals a day, when I had newspaper in my shoes. Would this mean I could buy a new pair of shoes? Would it mean I could eat lunch? We haven't got to that level of detail yet. We're hoping that'll come in the next few weeks. And then hoping to be able to advocate for consumers, to congratulate the government where these measures make a real difference to everyday Australians, and to continue to advocate where there's not enough movement yet for us. So I would like to, we've got a webinar coming up with the Minister. I might just mention that now, and then I'm going to go to the Q&A. So if you go back to, well, we've just, oops, gone all the way out of the slideshow. That's okay, Jenna. We'll go back to the one with the Minister. 2, 3 forward. We're almost there. Sorry, it must be very clicky, that mouse. Apologies, folks. We have the Minister Mark Butler joining us for a webinar on Friday, the 9th of June. We just need to go, I think, backwards one, Jenna, because we've got the contact details there. Oh, it seems to be skipping between 2. Should be the one just after that. Anyhow, it's in your slide pack. Love you all to come along and ask your questions for the Minister, so that we can provide him with your thoughts about the impact of the budget. So in the slide, we've got the wellbeing slide on at the moment, Jenna. It should be one more click forward, hopefully. Should take us to the right one. Let's try. Oh, no, it's going, either that one's missing or it's going between contact and wellbeing. Not sure what's happening there. Don't worry, folks. The slide is there. We will send it out to you. So now I'm going to ask my colleague to help you and help me in working through some of the key issues you've raised in the chat. So thanks. Jo, where do you want us to start?
Well, we might start with something that's come up in the chat from a few people, which is around My Medicare and the voluntary enrolment. And a couple of people are concerned that this might take us down the route of the NHS, where you have to go to a particular doctor even if you don't want to. And someone else has raised the issue about when you see a GP who is actually a GP who specialises in particular diseases, as opposed to seeing a GP for more general things, and will you be able to see both? So I think it's those kind of concerns about how restrictive My Medicare might be on people.
Thanks, Jo. I found that a little hard to hear. I'm not sure if you're muted or not, but I think maybe others, let me know if you found that difficult to hear or not. But I understand that the questions were around, oh, it's fine for you. Great, Sarah. Maybe it's just me then. So questions around My Medicare, and I think we'd have the same questions. What does this mean for you? Does it mean that over time, well, now this is a voluntary scheme, that sometime in the future you'll have to register with a practice? What if there is only one practice locally that you're able to register with? What if you don't want to register with that practice, or indeed any practice? What about if you prefer to work with a nurse practitioner? What if you prefer to work with some other health professional to help manage your care, say a paediatrician? How does that all work for you and your family if you're required to work with a particular practice in order to access Medicare? So we don't have the details about that, but I think it's fair to say that we know that consumers are interested to understand what this means for them, and that they don't want to see any change that reduces the healthcare they can get. And the second point, Jo, that you made in relation to people choosing if you like, an ensemble cast of health professionals. So you may well choose that this person's really good for these aspects of my care, this person's great for other ones. What does that mean? Does that mean I'll be able to have long consultations, bulk billed, if I speak to one over the phone or the video, but not if I speak to the other one? If that's the case, how do I choose where to register if there is more than one place that I want to register? And what if I don't want general practice to be the place where all of my healthcare occurs? What if I do want to work, say, with a health professional like a nurse practitioner that works independently of a general practice? How do I access all of those services through this? Because a lot of the measures that I mentioned do rely on a GP or rural generalist or someone similar with a medical degree in order for you to access that Medicare item number. So while we talk about multidisciplinary care, it's still clear that a lot of that money will flow through a practice, most likely a general practice, and that will be where the decisions are made about which health professionals are able to, if you to access free of charge, and what the models of care might look like. That's why we think it's so important that consumers are involved in these next steps, understanding the differences that are potentially there in different models of care, and advocating for the elements that they want to see put in place as My Medicare and many of these other reforming measures come into being over the next 6 months.
Thanks. Claire Mullins asked a question about how can we all as consumer organisations build more capacity amongst consumers to be active partners in digital health and digital transformation.
Yes, so we thanks Claire for that question. I think it's really important. So what we see in our lives everywhere is that health is changing, but maybe not at the speed as what's happening outside of health. So many of us are already now accessing our money online or on an app. We might do our shopping online, we might do our socializing online, and as the systems more and more in health move to that space, does rely on each consumer having not only the financial wherewithal to buy the things they need, whether it's a webcam, a microphone, I don't know, headset, whatever it is to engage, but also understand how to use all these things. So how do we make sure the consumers know how to do those, and how do we make sure they make wise choices? So many apps, for example, how do we know which apps we should be using and which apps we shouldn't be using, perhaps, and which will be best for our circumstances? And as in the early stages, Claire, when we're identifying the problem, how do we make sure that consumers decide what it is we need to do digitally, rather than technology driving change? How about consumers driving that change? And what do we do to make sure that consumers are there saying to those people that are building the technical bits and bobs, this is what we really need, and ensure that those things have in place the mechanisms that consumers most value.
Thanks. Murray McLaughlin wants to know whether there was any information on future given areas identified and funding levels for the National Preventive Health Strategy.
There was not much on the preventative health strategy that we could see. There were some preventative health initiatives, but not necessarily a preventative health strategy as such. And so it is difficult to see how that 5%, which was talked about, is going to happen over the next little while. So I think that's a bit of a watch this space and continue to advocate for more funding into preventative health. We're seeing funding in chronic disease, though we've said lots of initiatives and not sure how that all comes together and how a consumer decides which is the best service for them to engage with, but not necessarily prevention and health promotion and health literacy, much less activity in that space. And, you know, we always talk about wanting to have be working at the top of the cliff and ideally not even calling the ambulance, but a lot of these services are about when you're already sick rather than keeping you well.
Penelope McMillan's asked a question about CHF's funding, asking if it includes money for the Advocates Leadership Academy. So I think that's our Consumer Leadership Academy.
Hello, Penelope, thanks for the question. At this stage, we have very scant detail about exactly what it is the government wants us to do with that funding. We understand in broad terms that two main thrusts. One is to support consumers through the reform that the Strengthening Medicare Task Force report is leading. So how do we do that well? And the other part is to improve the capacity of health consumers to engage with the health system, which could include things like the development of a leadership academy for health consumers, but it's not really clear to us yet that that's exactly the beast that we'll be building. Stay tuned though, Penelope. We'll make sure we keep everyone informed as we know what it is we're meant to do.
Thanks. Penelope's actually got another question because she's interested. We're talking about commissioning integrated services, and she's saying, should we interpret what they're saying is that disability is being treated as a single group, or are we thinking that it would be disabilities as in the broader sense of them and more individualized service responses?
I don't think I can answer that. I don't think there's enough detail yet to understand how disability will play out. I think there's an increasing challenge in supporting consumers whose lives are not neat enough to fall into one group or another, even having a single disability or a single chronic disease. And someone who has, say, significant chronic disease, absolutely, Rachel, everyone is their own individual, right? So someone who's got significant chronic disease and also potentially is in aged care and also potentially is a participant in the NDIS, we're not really good at managing holistically, particularly because government's funding program lines. So we see a budget with portfolio budget statements, and clearly this silo does this bit and this silo does this bit. And then we look into another portfolio and see there's work that might actually collide with something that's in, say, health. I'm on record as saying, you know, the problems that people have increasingly, we expect government to be able to manage across our life course, across ourselves as we present ourselves holistically into the delivery of services. And I think governments struggle to do that because the way we ask them to manage our funds is still very linear. And we see this play out in policy. And I think it's time for that to change.
There's a question in the questions about, was there anything in the budget for social prescribing?
Didn't see the words once. I think you could safely assume, though, that some of the funding that's going to chronic diseases and allied health and so on would allow those providers to offer a social prescribing model of care. So while we don't see it discussed openly, there was a mention of it from memory in the Strengthening Medicare Task Force report, but it doesn't come into the budget papers, at least not what I saw. Feel free, if you saw it and put it in the chat and you've got a page number, do let us know. I think we're relying on the next stage of detail where we talk about all these approaches to chronic disease. So, for example, there's that place-based piece where we've got a whole lot of players around the table. Would they offer one of their options of service delivery be social prescribing?
And that's all the questions in the question and answer. In the chat, there's a few people raised the issue they're very disappointed that there's nothing more for allied health. And I guess, you know, they're sort of saying, well, what can we do about that? So do you have any ideas about how we can advance the need for more allied health?
So, and I've kind of alluded to this already. What we can see is budget measures that talk about wraparound care, talk about chronic disease, talk about multidisciplinary care, the PHN's funding allied health services in places where the workforce incentive program wouldn't allow that to happen. So we can see there's an intention to utilise allied health more broadly to support people, particularly those people with chronic disease. And so to reduce, one would hope, the out-of-pocket costs for people who need to access allied health services. What we don't see, and it's a bit similar to me for nursing, we don't see opportunities for allied health to be leading so much, and clear statements that the cost of accessing allied health would diminish for consumers. How do we fix that? Well, it's about having a strong voice as consumers and all of us coming together and advocating with one voice. If I know anything, I know that if governments get one strong message from a whole sector, they tend to think that that's the direction to go in. While we all give slightly different messages about slightly different things, governments can be not sure if they have the strong support of the sector to move in a direction. So I think if we think allied health is one of the next frontiers, for those of us that are responsible and have leadership roles in this area, it's for us to come together and make it very clear to government what we think consumers would like to see in relation to allied health, to work with the professions too, of course, and come together with one voice to say, this is all great, this is the next step, allied health needs a consideration that we haven't seen quite yet. And then we've got 12 months till the next budget, folks, so, and even less to my FO, so then it's work hard.
Yeah, there also is a couple of comments about the relationship of PHNs with other service providers, particularly community health services, and whether there's anything in the budget in terms of what PHNs are going to get funded for and do that would encourage them to work cooperatively.
Yeah, so in terms of community services, it's a bit tricky because the PHN program is national and the community services often funded by state governments vary from state to state. So some states, for example, invest very heavily in community health services. Others don't at all, or perhaps did in the past. I'm thinking of Queenslanders out there that would have had a lot of that funding removed over a period of time, versus, say, Victorians, where there has been traditionally a big investment, though that's, you know, not as strong potentially now as it was a few years ago. So for the federal government to say this is how we expect PHNs to work with everyone is difficult. And of course, that's one of the benefits of PHNs, is that they're meant to work with the local community, with the services that are available locally, and bring everything together. So, but I think there is you know, I'm a fan of shared and transparent scorecards for everyone, so that everyone has a reason to work well together. So it could be the local PHN, the key community health organisations, whether they're NGOs, government funded, the local hospital network, and a couple of others that have agreed KPIs or outcome measures of some kind that they all agree they will work towards in some coordinated or collaborative fashion. Again, I come back to, well, everyone gets funding, often for throughput, often where it's not a requirement for them to collaborate, and where most people believe that whatever they're doing is in the best interests of the community, and perhaps it is. It's sometimes difficult for people to see the benefit from the perspective of the consumer. And so what consumers often see, it often reminds me of the back of your computer. A lot of cables going in and out, and no clear idea of which one to pull out or which one is going to unlock the secrets of the universe or turn your monitor on in this case, where consumers more and more want that kind of experience they see, whether it's Netflix, Etsy, Steam, or even Amazon, where you can go to one interface. All of the sellers are there. You don't need to know how many sellers they are. You don't need to know what they do behind the scenes to make sure that you get the service you want, who the courier is. I mean, imagine having to go through your banking app in order to go to a service and need to find out from them which banker they used, and then understand which courier they were going to use in order to buy a new pair of shoes or to stream a service. So what we see is, outside of health, changes in the way that we do a lot of our activities of daily living, and that not reflected in health. And the burden continuing to be on the consumer, on their family, carers and natural supports to navigate all of this, because while service providers don't have to do it, it's not a requirement, maybe they don't always see the pain that it causes for many of us.
Janet Baker's put a question in the questions about, do you think there's anything in this budget that would help improve access to primary care for people living in residential aged care, and particularly people in regional and rural settings?
Well, someone can refresh my memory, but I think there was an increased incentive for GPs to go into residential aged care. That incentive was reduced a few years ago. It seems to have been increased again. So that's a good thing. I think I'd like to think of primary care as more than general practice. I'm a big fan of GPs, but they're not the only people that work in primary care. So the question is, how do we bring all of primary care into aged care in a way that works for the small businesses that are engaged in that work, but also works for the residents and their families? I think that's another area where we haven't solved the problem yet. And whether people are living in place at home and require significant care, or whether they're living in a residential environment, whether it's a retirement village or an aged care facility, there's a lot more we can do to make sure that Medicare doesn't rely, and your access to universal healthcare doesn't rely on your mobility. So we see this even with people with significant disability, as well as people in remote and rural communities, and people living in institutional settings like aged care, that the services offerings often rely on you being able to get to them rather than them coming to you, whether that's virtually or in real life. That has to improve, and we would certainly strongly advocate that that's important for consumers.
I think that's got us to the end of both what's come up in the chat and in the questions. So if anybody's got a last question, put it in the questions now. So we're just I guess one question that did come up previously was, if you don't like your My Medicare provider, can you change easily?
So in theory, yes, would be the answer. So the conversations have been, and I think it maybe even mentioned in the Strength of Medicare Task Force documentation, that it should be portable. I think there's the practicalities of that. What does that mean? If you want to move from one to another, how easy will that be how quickly will you be able to do it, and will you be able to even find someone that can meet your needs if you need to move from one to the next. So while we just look to see if everyone has got any last questions. Jenna, I don't know if you can put the slide up with our socials on it, which is the last slide in the pack. We would really encourage you, if you don't already, to follow us on our social channels. We have newsletters. We have all manner of ways to communicate with you. Oh, look, there's the Minister slide. Thanks, Jenna. So let me mention these in the last couple of, oh, there we go, socials, great. So these are our social handles. I really encourage you to engage those. Remember, these will all be in the pack that we send out to you. So if you didn't catch that all right now, it's okay. You'll be able to catch it later and amplify our messages. We're really trying to make sure that the views of Australian health consumers get the same amount of airtime as those of other organisations, particularly those who have vested interests. Our interests are simply making sure that every Australian gets the best healthcare they can, and they stay well and they stay out of hospital. So anything you can do to help us get that message out is really much appreciated. So we encourage you to follow us and be social and lead with us as we try and make the difference that Australians deserve in their healthcare. Any last, thanks, Jen, you can take that off. Any last questions, Jo?
No, none.
Always really happy for your feedback. You can pop it in the chat now. If there's anything else that you didn't find out about that you would have liked to know about, we can consider how we can provide that to you in another format. As I said at the beginning, for those that were late, we will share this recording. We'll also share separately the slide deck so that you can go through both of those things and you don't have to sit through me talking for an hour in order to read the slides. We'd like to thank you for all the work that you do and for joining us today. It's really delightful to have you all here with us. And we hope that many of you will join us for our meeting with the Minister in a couple of weeks, where we'll be asking him the hard questions about what this budget means for consumers. Send in your questions, put in your diary and come along. For those of you that feel like they'd like more to be done, this is your opportunity to ask that question to the Minister in just a couple of weeks. Thanks, everyone.